Again, we're reviewing again for the purpose of what? Mastering the subject, right? Why do we review over and over again? How do we master something? You know, we know how to go to the grocery store. How? Because we've done it a million times. We know how to drive a car. Why? Okay, so I don't expect you to get it the first time. So we're going over this again. All right, so we determined in the cell theory, why do we need food? Okay. Now we're choosing a nice little succulent apple to consume. I mean, we could get you want me to draw a chicken wing or something? For normal society? Okay. What do we put it in?
The mouth.
The mouth. And what do we have that comes in here? Some type of enzyme, right? Okay. What type of enzymes?
Mucus.
Would we have any digestive enzymes in this? Okay. Right, yeah. So digestive enzymes, right? Why do we do it now? Because we're trying to what? We need to chew more than most people chew, right? Because of what?
We need
the more
to break
we
down.
chew, the more these enzymes do what?
Start to break down.
Now we're not digesting, we're chewing, right? All right, we're masticating the food into a bundle of joy, right? All right, so what do we have that closes off? What is this right here?
That's your esophagus. Trachea. Oh,
Okay.
and the esophageal sphincter.
What covers the trachea?
Epiglottis.
Why does it cover the trachea? What is the word? It starts with an A.
Aspirate.
Yes, okay. Is this going to happen every day in your nursing life? Okay, in the sense of worrying about it, yes, okay? Because we don't want, what? Food going into
the lungs.
The lung, right? Because do we have any way to get it out other than coughing? As a human being, without medical intervention, we're pretty stuck. All right, so when we say the upper esophageal sphincter, what do we mean?
Top of the throat.
Up the top, right? Does it, now I'm breathing, what happens to this? Does this slightly close?
Yes.
Right? I mean, so what is the point about this sphincter? Okay? It's the last line and the beginning line of what? Food going in and out, right? So when this closes, the food can slide right down, right? So we'll have a little sphincter here. So it'll slide right down. So do we have a lot of problems with this? Well, there's some issues that come along as we age. Remember we were talking about the gargling effect and practicing these muscles in here? Well, I mean, who gargles anymore? Well, I mean, but you're testing what? This sphincter, this what? Epiglottis, because it's not rolling into our lungs when we're gargling, right? But we're trying to get it as far back into the throat as possible, right? Into the pharynx grouping. All right, so I mean the point is it may or may not reach it, but the body surely is what? It's getting stimulated by it, right? So we know that the upper esophageal sphincter is really important to let what? Food in. Okay, some people choke because what?
Food can't get by.
They can't even get by this one. So we do a what? A swallow test. What is the swallow test really doing? Is this closing? Is this opening? And is it getting even into what? The esophagus, right? So now does the esophagus take a long time to push the food? Here's my little apple. How long does it take? I mean, hours, days, minutes, seconds?
Seconds.
Seconds. Okay, so it's down to what? What is this?
The lower esophageal sphincter.
Now, why is this so important?
It lets food go in and prevents it from coming back out.
So the LES, if I have acid reflux, how do I have acid reflux?
The sphincter is opening and allowing the acid back into the esophagus.
Right, so and does the esophagus have these wonderful cells?
No.
Not the same as a stomach cell.
No.
Okay, so it's not lined quite well enough it doesn't have some of the bicarbonate and other productions that the stomach gets the advantage of. So the hydrochloric acid is not very nice to the esophagus, right? And we can have Barrett's esophagus, which leads to esophageal cancer if we chronically do this. Okay. So, not a big deal, but is it important to know that these cells are not being broken down too quickly and causing what? Some type of irritation, right? Because if we have one here, we've got a problem, right?
Yep.
Okay? So could people cough up blood from this?
Yes.
Okay, so how do you know they're coughing up blood from the lung or here?
It's
Yeah.
visible.
Okay?
Right.
It's an interesting question, isn't it? I mean, the only reason, there's not always an answer to every question I may ask, because I want you to think about it, that, you know, you don't always know what someone's coughing up when they say, here, look what I coughed up. Okay. Yeah, well, I mean, you know, they're going to show you.
Yeah, I know.
You know, they love to show and tell, you know, look at what I coughed up. So, the food comes in, and it has to go through this sphincter. Is that an important sphincter? Yes, we determined that if I lay flat in the bed and I've just eaten a full meal, am I putting more pressure on that sphincter?
Yes.
Yes. What is the number one rule to do with a patient that's suffering from severe heartburn?
Sit them up. Elevate
Elevate the
them.
bed.
Yep.
You know why? Because we're taking what? Gravity
Pressure
is
off
now
of.
keeping pressure down, and this sphincter can hopefully.
Stay closed.
And there are other drugs, medications that we don't need to go into that help this sphincter work. Okay. What happens when you get pregnant? Yeah, everything gets pushed up. So does this certain hormones increase this tone? Why? So you don't have what? Acid reflux. You still get it, but not nearly as bad. You know, hopefully none at all. But okay. So now we put food into the stomach. What is the stomach designed for?
Churning.
Right? Do we absorb
Grinding.
anything to account for anything in the stomach?
No.
Okay. In general, where do we absorb our food?
Small intestine.
Small intestine, right? Okay, so mainly, what are we doing here in the stomach for hours on end? We're
Churning.
Churning, right? And we're making what? A nice ball of
Chyme.
chyme, right? So it's all ground together. Why is the gallbladder floating around out here?
To dissolve or to help with fat absorption.
Right, and where does it
Break
dump
down of fat.
into? Does it dump
Right into the small
stomach,
intestine.
or- yeah, over through here, right? Okay, we have this little hepatopancreatic ampulla, right? It's going to dump all of our stuff right here in the small intestine, right? All right, so we're just kind of getting this picture together. What is this?
That's pancreas.
Pancreas. This is the stomach. This is the gallbladder. So we have our friend the liver laying over top. Okay, lots of things, but we're trying to take a few things out of the way to. So it sits how long in the stomach?
The chyme.
Very good question. How long does the chyme sit in the stomach?
6 to 9.
Yeah. Okay. If I just drink orange juice, is it going to sit very long?
Nope.
And I have nothing else for it to mix with.
Nope.
Okay. If I just ate a piece of steak, is it going to sit longer?
Yes.
Okay.
Long time.
Right, because it's more complex, right? So the more we put in that's complex foods, the more this has to churn. So if my diet is nothing but steak every day, all right, what am I doing? Am I increasing the work of the stomach for that week?
Yes.
Okay. Why? Because it requires more work, more energy to what? Okay. So, what's important to note here? Why is a liquid diet so helpful to people when they're having digestive problems?
It's less stress on the stomach.
Yeah. Does the stomach have to work very hard? No. I mean, most of it is being what?
Dumped
Okay.
right into the.
So, I mean, we have a time frame. So, how does it get dumped? Wait a minute. When does it know? What sphincter is this?
Pyloric sphincter.
So this controls the food in and out, but this is the big boy to let it go where?
The small
Small
intestine.
intestine. Okay, now if we have a hyperactive dumping syndrome, you know, the faster it comes out of the stomach, the more the small intestine is going to have to work, and then this whole process to the rest of the intestines go through, right? Okay. Pyloric. Lower esophageal. Okay? Why are these important? Because they're two different sphincters, right? This is at the top, this is at the bottom. So try not to get those confused when it comes to sphincters, right? Because these serve different purposes, correct? Okay, so it's important to know the layout. There's the antrum of the stomach, there's the fundus of the stomach. I mean, these are just layouts characteristic to every stomach, but that's not necessary for you to know. Just that the stomach is what? A bag, right? To do what? To hold food and churn it away. Where do we do all our absorption? Mostly.
Small intestine.
Okay. So we call absorption, in layman's term, digestion, right? So now this food has come into the large intestine. What do we want to dump out there?
Waste.
The what? What is our pancreas going to put?
Or our enzymes.
Oh, what kind of enzymes?
Gonna put lipase,
Okay.
amylase, and pepsin.
Lipase. What is that for?
Break down fats.
Lipids, right?
Yeah.
Amylase.
For sugar, glucose,
Carbs.
carbs.
That's fine. It's synonymous. Okay. And what?
Pepsin for proteins.
Protein. If you can remember that, that's pretty good. Those are our digestive enzymes. Okay? Before we get out of the stomach, let's go over the stomach cells for just a minute. Okay, does the stomach have mucus? Does it have a mucus lining?
Yes.
Yes. Okay. Now I've highlighted a little ridge of the stomach, just a bit, including most of the stomach cells. Okay, different types of cells. So we have mucus-producing cells, right?
Yes.
So what do they produce? Mucus.
Mucus.
Why do we need the mucus?
To protect the inside of the stomach.
From their hydrochloric acid, right? So we have a bunch of, if I could write, hydrochloric acid here, right? So let's forget the parietal cell for a minute. The chief cell. What does the chief cell produce?
Pepsin.
Pepsin. A few other things, but why would it be nice to produce some digestive enzymes in the stomach? If you're eating steak, it's going to help what?
Break it down.
Break down that steak, that protein, that amino acid. What do we get out of the amino acids? Essential amino acids. Okay, what's the byproduct of that? Of amino acid breakdown?
The byproduct?
Nitric.
Oh, nitric
Okay, and
acid.
then it goes to the liver and creates ammonia, right? Well, there's no sense not
acid.
reviewing it.
That's right.
All right. So what is the G cell? All right, it's down here in the bottom of this. What would it be useful to produce? Hey, gastrin. Okay, hydrogen. Why? Help the mucosa
mobility.
What? We want the gastrin, the G cell is going to help us what? What if we put a lot of food in? It's got to get busy.
Move it along.
Yeah, we got to digest this stuff. No, we have to break this stuff down. Okay, so we got to hurry up and break it down so we can digest it later. All right, so basically if you know the chief cell and the G cell, hey, you've got an idea that, hey, there's a couple cells here in the stomach that are busy working. Okay? Busy working doing what? You know, I mean, trying to help us break down the food that we just ate. All right, we're not on a liquid diet, everyone, right? We eat food, right? Mm-hmm. Okay. So then we have this famous parietal cell, the number one cell you must know out of the stomach, right? Now, the parietal cell does what? It helps us with the intrinsic factor to code what? B12, so we can what? Absorb it later, right? Digest it later. If we do not produce the intrinsic factor, what won't we absorb?
B12.
B12, and what are we going to be deficient of? And we're going to have macrocytic anemia because we're not going to have enough B12 to mature the red blood cells the way they should be. What else does it do? Hey, gastric acid. Oh, what is this? It slows down what?
pH.
Yeah, I mean,
in the stomach.
You know, it's an interesting little regulator, right? Oh, okay. All right. So I had written down nitric oxide. Well, that's good. We'll come back to that later. So basically we have this idea that there's a chief cell, a G cell, and a parietal cell, all in the stomach. One is for mucus, which I left out, the mucus cell. That's common sense. The G cell, hey, we've got to produce some more hydrochloric acid somehow, all right? The other thing, the chief cell, well, hey, we may need some digestive enzymes. We can't expect the pancreas to have an outlet into the stomach, so we have a cell to help us produce that. All right, so this is the parietal cell, okay? We have a lot of issues with too much stomach acid production. What did we go over? What is one of the major drugs that people will take to stop stomach acid production? Zantac, right? So, which we call Ranitidine, right? It blocks the H2, what? The hydrogen receptor in here. All right, so is it important to know where does Zantac work?
In the parietal cell.
On the parietal cell, okay? That's what I need you to know is that, hey, it's going to slow down what?
Acid
Some
production.
of the acid manufacturing process, okay? Where? In the parietal cell. Do you need to know exactly how that happens? No, if you want to, that would be great, but not necessarily. Here's acetylcholine. All right, well, that's from what? You know, our sympathetic response and certain neurotransmitters. So, you know, it's going to turn on, you know, the stomach and saying, hey, I've got to hurry up and digest this food because someone just pulled a gun out at me, right? You know, meaning the sympathetic system turns on, right? So is that important? Yes. How else do we block some stomach acid? Okay, well, what if I want to stop where the prostaglandin turns on? Oh, this drug, misoprostol, right? Why? It increases mucus and decreases acid manufacturing or production. Is that a good one? Yeah. There's some reasons not to take it. There's some reasons to take it. Okay. What else do we have? We have omeprazole. And it's called the proton pump inhibitor. That means the hydrogen and potassium pump that what? The parietal cell uses, what does it do? It slows this pump down, but really it turns the pump off. So, which is the bigger problem? An antacid obviously just neutralizes what? The hydrogen production in this area. So, antacids kind of just do what? Something very simple, right? Ranitidine does a little bit more. It blocks what? This histamine receptor, okay? So would you rather long-term use, which one is, one's blocking a receptor and one's turning the mechanism of the pump off?
Rather block the receptor.
Yeah, I mean, in short term, hey, my stomach's upset, let's block this receptor, and you know, in an hour, I'm going to feel better. Why does Prilosec and all the other drugs take so long? Because they've got to turn the pumps off, okay? So that, you know, it's just like the well that you have out there and you've got the pump to get the water out, all right? It takes a little bit longer. Which drug is more effective? Well, obviously, if you're turning the pump off, you have nothing really working, right? So can you get imbalances with everything else?
Yes.
Yeah, because the cell is basically saying, are you kidding? You know, you're cutting me off at the knees. So, you know, are you going to have a few more? Why are you seeing the magnesium absorption and other? And it's questionable about even this absorption, but I mean, you know, not enough studies. This is a short term. You got to take it. This can be accused of permanently damaging these parietal cells until they regenerate. So you'll hear that these are permanent, and these are take it every day. So it's a debate as to which one's more effective and why. Why are we doing this in the first place? Why are we even messing with the parietal cell? Why are we taking these drugs in the first place?
For comfort.
Right, because someone's saying, ow, my stomach hurts, right? I'm nauseated, I have burning in my stomach, whatever, right? Has anyone experienced this in the room? I'm assuming everyone has. So we've made up different drugs to what? To help us feel normal, right? However, it would be nice to figure out why the excess stomach production is happening, maybe in the sympathetic world, okay, and maybe the nervous system, maybe we have just too much stress and these parietal cells are turning on too often and are not regulating how much we're producing out of the other cells, right? Does this make any sense?
Yeah.
We're trying to do what? Create a balance when there's an imbalance. So is the stomach under constant duress? Yes, because it has hydrochloric acid floating around and it's trying to help us break down the food. Now, are we going to, if we mess with the hydrochloric acid and we decrease its acidity, are we going to mess with its ability to break down the food?
Yes.
Yeah, so hydrochloric acid needs to be acidic. So if we take it up and we neutralize it a little bit more, what happens? We don't break down the food as much, so it has to do what? Churn even more. Okay, so when you're looking at issues of motility, it would be nice if we could turn down the motility, okay, so it's not churning so much. But then we have a problem of, are we actually then breaking the food down enough to even hand it over to the small intestine? So where do we take all our medication? What does it affect? Okay, the parietal cell. You know, bismuth, you know, Pepto-Bismol and the others, you know, what are they going to do?
Neutralize the acid.
Yeah, they're trying to coat the mucus production and provide a layer, okay, for where there may be an ulceration or an irritation. So they're trying to coat it, right? Does it work? Sure. Okay? But I'm trying to give you a generalization that everything is working either here at the parietal cell, or we're trying to, what? Increase it by taking digestive enzymes that we put into the stomach to help break down food faster, or we're trying to protect the layer where the ulcer has already happened. So what if I have an ulcer in my stomach? What's the problem here? It's now an open lesion. What are we going to have to do? We're going to have to make sure that it doesn't get any bacteria, right? Okay, we're going to have to coat it, right? And we're going to have to do what? Slow down some of the stomach acid for what? So it can have a chance to repair. Do these cells regenerate?
Yes.
Okay. Also, now remember we were going over cell theory. Does this cell have a brain?
Yes.
Right? Here's our... Now, does this cell have a need for energy?
Yes.
Right? So what is that? That's our mitochondria. Right? And does this cell have a Golgi apparatus? Well, it better, because it looks like it does a whole bunch. So it may have a couple Golgi apparatuses, because it looks like this parietal cell has what? A couple functions, right? So now, why is, when we learn about basic cell function, now can you tell me, can the stomach, if we're not getting enough oxygen, we're not providing enough glucose into the blood system for this cell to work, are we going to be able to digest food properly?
No.
So if my sugar is low, and it's stayed low for a period of time, what's going to happen to this food in my stomach?
It's going to stay in your stomach.
Yeah, because its stomach is what? Slowed down its ability. So this is why I want you to think about it in an overall picture. The intimate details, if you want to, can always come much easier, but if you can tell me this is how we speed up a stomach, this is how we slow down a stomach. When we go to sleep at night, is the stomach working?
Yes.
Yes.
Yes. If I am running outside and doing exercise, is the stomach working?
Yes.
Okay. So, if I'm under stress and I'm biting my fingernails off and I just can't stand it, what is my stomach doing? It's taking it as a stressful response, and it's doing what?
Overreacting.
Yeah, overreacting, because it's saying, you know, you're giving me enough stress. So what seems to happen here is this system doesn't have a lot of what? Stopping power. I mean, so how could we possibly, why is relaxation great for acid problems? Not alcohol, because we're only adding to the problem. Why is mental relaxation helpful? Because what does the brain perceive it as?
Well, It's a calming
know,
effect.
Yeah, calming effect. So what is the stomach going to do when it's calm?
It's going to slow down.
Yeah, it's going to slow down and be more functionable. Okay, because the faster you speed the stomach up, can it move a whole bunch faster? In some ways, but it's going to create what? More hydrochloric acid to get what? The food to what?
Break down further.
Even faster. So the more stress we're under, the more hydrochloric acid we produce. And then the more the body has to deal with that problem. So you can see that there's a point of no return that the body can't compensate. All right. So everyone's clear on the stomach and the parietal cell, and that different drugs do different things on the parietal cell. Same effect, but different mechanisms. Some are better than others. It's debatable as to why and for what reason. So it's not really important to say, oh, gee, this one sucks, but this one's great. Because they're all valuable. Do you see people taking omeprazole and ranitidine at the same time? Yes. Why do you see them? Because they may be so nervous and so upset all day long, you have to try and catch all the millions of parietal cells in the stomach with one or two of them. Okay? And you're trying to what? Turn off the pump? You're trying to stop the acid? You're trying to do everything because it would be nice if you could help them learn to what?
Relax.
Yeah, calm down, relax, find some happiness in their life. And look, that's a very difficult statement that I just said, but if they can, you know, obviously this is going to slow its production down because of what? The sympathetic, parasympathetic responses to stress, right? Okay? So if I'm really nervous, is my stomach going to work extra?
Yep.
All right? So if I add alcohol, is that helping my problem?
No.
Okay, because, you know, what's going to happen with the alcohol?
Well, it's going to sit in your stomach. It's going to do the same thing.
The body doesn't know a lot to do with alcohol in certain ways, but we'll get to that later in a more intimate biomechanical process. So, we have discussed the stomach. All right, we know that the lower esophageal sphincter keeps it in. This is where our acid reflux happens. Okay, we've made the ball of chyme. Now it's pushing it out through the pyloric sphincter. Does it push all the chyme out at once?
No.
No, because does the small intestine swell and engorge itself? Now, because remember, the stomach can get bigger and bigger, right? We keep eating, it'll stretch, and there's a limitation to its stretchiness, but it can stretch. The small intestine doesn't have a lot of extra folds to do what? To stretch. So this thing here has to be well regulated. So if we're under stress again, is it well regulated? No, I mean, it's like, get this food out of here. Hurry up. Get this food out of here. So, it's fine. So that's another problem that we have to worry about. So it releases some food. We're all in agreement that it releases some food to what? The small intestine for
absorption
or digestion. Okay, important stuff. What are we going to release from the pancreas to help us digest? These digestive enzymes, right? Now, is it important for you to know the digestive enzymes? If I have pancreatitis, this is going to be severely elevated, amylase. Okay, you're going to know this as soon as you do what? The blood draw and tell me, hey, look, these are elevated. So we know the pancreas is really upset, right? So lipases for lipids, amylases for carbs, pepsin, proteins. Well, if you can remember that, that helps us do what? Absorb the food. How do we absorb the food in the small intestine?
Through capillaries.
Right, through the capillaries, but how do they get there? Hey, there's this thing called the goblet cell. Okay? We have the villi and the brush border that move the food along, right? And it's moving along as we go. And the food is just rolling along. Here's the food rolling along, food particles rolling along. And all of a sudden, this goblet cell says, hey, I know you. I'll take you in. Right? Where does it take it in? All of a sudden, here's the capillary and the lymph system. And the fats go into the lymph system, and the other nutrients go into what? The blood system. Okay? So you can understand that here's the fat rolling along. That's why we have the brush border. Okay, and the villi are just moving it along, and all of a sudden it gets absorbed, right? Do we have to really break down how it gets absorbed through the goblet cell? I mean, let your imagination wander, but I mean, obviously the goblet cell has what? It's going to have a mitochondria,
Yeah.
okay? It's going to have a DNA, and it's going to have a bunch of little gates to do what?
Allow food to pass
Allow
through.
passage of food to come in, okay? So you see how this works. It just goes over and over and over again, and we have, in terms, miles of small intestine, okay? We have, 12 feet, 13 feet, but in the consideration of the folds and the villi and whatnot, we have lots of surface area to absorb all this food. All right, so by the time it goes to what? What's after this?
Large intestine.
The large intestine. What comes out of the large intestine?
Waste.
Waste, okay? Do we absorb anything out of the large intestine? I mean, there's this mild issue of water things and some bicarbonates, but mainly we're trying to do what with the waste?
Eliminate.
We're trying to eliminate it. We're trying to get some last nutrients out of it. Okay, what is this sphincter? The cecal, and I can't spell cecal today, but that's all right. The IC, okay, connection between what? The small intestine and the large intestine. Now there's a problem there because we have the appendix around here. Why is that appendix sitting there? It's to monitor, are we getting the proper waste where? Into the large intestine. If it's not very healthy, what happens to the appendix? It fills up, and it says, uh-oh, I have a problem, and then we have what? So our appendix is kind of like our boil over point, and it's our warning, so it can help us, but we have to take it seriously. If we take out my appendix, what are you going to tell me about my diet?
You're going to have to be more clear about your intakes.
We're going to have to get some more fiber in my diet as well because we're having a lot of issues here as well. So what does fiber do? Do we digest fiber anywhere?
No.
So where does fiber end up?
In the waste.
In the waste. And it makes a difference with the H2O and the fiber, so it makes a more formed what? Stool. Okay? So what happens when we take, a purgative in the large intestine, like senna, and we make the motility, the increase on the large intestine? What's going to happen now? We're taking it because we're constipated. We haven't had a bowel movement in a while, so we're going to increase the peristaltic motion to get what? The stool out.
To flow.
So there's a danger there because now what are we doing? We're increasing it faster. So if we take a laxative or we use anything else to affect the H2O absorption, mineral oil, other things, what are we doing? We're now messing with what? That barrier. We're hopefully trying to create some type of mucus barrier that this can come out more smoothly with more water. If it's a dry, hard stool, what's going to happen to this large intestine? Yes, I saw that face. What's going to happen to this intestine over time? If you do this for 6 months or greater, yeah, it's going to irritate it. It can get there's a ton of things that can happen. What if it's too loose and it's not formed?
Diarrhea.
Yeah, and is that good too?
No.
Okay.
That's moisture loss.
Yeah, we have dehydration issues. What do children die of all over this world?
Dehydration.
Forget the virus that causes it. Yeah, but we have dehydration. Okay, rotavirus is #1 for diarrhea, and unfortunately they can't get the fluids back and they perish, which is absolutely ridiculous and terrible that we can't find a way to fix that. Okay, so we've got the idea of the large intestine, right? The small intestine needs help. Okay, we did their digestive enzymes, but there's other cells, right, in the pancreas. Okay, what? The eye cell, it produces CCK. What does that do? It increases the pancreas and gallbladder function. So it's telling you, hey, dingy, get busy. Do more, right? We're not doing enough. Do more. Give us some more bile. What does bile help us with?
Oh, fat breakdown.
Fat, right? So if I eat a high diet of fat, what am I going to be using?
A lot of bile.
A lot of lipase,
lipase.
and a lot of bile, right? Now, is that nice here on the small intestine? I mean, it's used to it, but is it nice?
No.
Here's another thing. Let's look at this. Secretin, out of the S cells, right? Bicarbonate, right? What is bicarbonate? It's a base
It's
or
a
an
base.
acid? Right, it's a base. What if I'm dumping constantly high acidic kind because I'm always under stress? What am I going to be making more of over here?
A lot
of
of base.
bicarbonate. So is my pancreas going to be happy with me?
No.
Because it's like, hey, I've got to produce 3 times the bicarbonate to offset what?
The amount of
Hydrochloric acid you coated this food in, right? Because hydrochloric acid is it a nice acid?
No.
No, okay? It's very acidic, okay? So we can compare it to battery acid or whatever other acid that you want to say, wow, that dissolved that penny, I can't believe that. Okay, why? Because it can. So this base has to neutralize it. So all this is happening where?
Small
In this,
intestine.
yeah, in this area. So
The
where are we
pyloric
most likely to get a lot of ulcers?
Just below the pyloric
Yeah,
sphincter.
I mean, we're putting a lot of pressure on this small intestine that doesn't have all these, it has mucus cells, but it doesn't have, you notice, we drew most of the cells, goblet cells and a few, but it, you know, it's not as nice as the stomach cells grouping. So what else do we have? We have the D cells. All right, this is growth hormone, okay, but it also decreases our insulin and glucagon. Why do we do that?
So we don't get too much in the system.
Right, while we're what? Absorbing food? Because we don't know what we're absorbing, right?
Right.
We have to first what? Absorb it and figure out what it does to the system, right? So we have to kind of turn this off. All right, so we can get into why there's diets that you eat every 2 hours, and then there's why there's long diets that you eat twice a day. Okay, and what is it going to be messing with? You know, our insulin and glucagon issue, because sugar's too high, what do we produce?
Insulin.
Sugar's too low, what do we produce?
Glucagon.
Where do we get the sugar from for the glucagon? Where does it go?
Muscles.
Right, and it's looking
Liver,
for, what
fat.
is it called? Stored glucose. What is stored glucose?
Glycogen.
Glycogen. Okay? Insulin, it already knows. It's pretty simple. It's like, hey, sugar, come with me. We need you. Okay? Otherwise, it's going to store it as what? Glycogen. Okay? So this is kind of slowed down because it's kind of confused. Well, am I getting a lot of sugar? Am I getting a lot of protein? Am I getting a lot of fats? I'm not really sure. But until we're sure, why would we have something like this? You know, yeah.
To keep it in check and let it do its job.
Balance, right? To say, uh-oh, we got a lot of fats. Well, don't turn these off.
Right.
I didn't get a lot of sugar. I got a lot of fats. So just keep going. So we're going to produce a lot of D cells? I just ate a bunch of chicken wings. I'm not going to produce a lot of what? Growth hormone.
Right.
Right? I'm going to produce more secretin because, of the fats. All right, so then we have what? The K cells. Now this is we didn't get a chance to go over this. This is the GIP and VIP. Okay, and you say, well, is this important? Okay. Just don't worry about what this stands for. It's pretty simple, but think about it. I want to increase insulin. Now we have the D cells saying what?
Insulin down.
Insulin down. We got to have something that says insulin up. Okay. What if I'm eating a lot of food and I'm dehydrated and I need electrolytes? What does VIP do? It says, come on, hurry up and digest this. Right? What do we need? We need electrolytes, right? Sodium, potassium. Where do we get our electrolytes? Some of it from the kidney, obviously, and the nephron, but do we get a lot of our water
absorption system
through the absorption here? I mean, think about it. You drink a glass of water. How did you absorb that water?
It went through your stomach very quickly to the small
To
intestine.
where?
To the small intestine.
And how do we absorb it? Oh, it just kind of coats it, and we just filter it through. Well, there is a process. What if we drink too much water? Do we want to what? Absorb all that water?
No.
Can we take all that water in? I mean,
We can take it in.
Helpful.
But we can't use it all. We
Right,
can take
so
it in.
what happens? Can we overstimulate ourselves with water? Can we overhydrate?
Yes.
Okay, And the body's going to have to do what? Then absorb this and do what?
Get rid of it.
Get rid of it where? Through what other system?
The kidney,
renal system,
through the renal
right?
system, through the
Okay.
kidneys.
So is that good? Yes, but what if you did it every day? I'm going to drink 4 gallons of water every day. What are you going to tell me as a nurse?
You're taxing your system,
Okay,
your renal
yes.
system heavily.
All right? What if I'm going to tell you I'm going to eat 5,000 calories a day?
I hope you're exercising a lot.
Right, because what is my pancreas going to be doing, or what is my stomach going to be doing?
Overworking.
Okay, because the more food you put in, so what if I tell you I'm stressed out? I can't, you know, I'm taking, I just can't, what are you going to tell me about my food consumption, my diet, and my pancreas?
You're overworking your stomach, number one, because of the stress level. You're producing way too much stomach acid. You need to calm down.
Right.
Chill out. Calm down.
And I have to find something. Now,
Find
is
something to make
alcohol
you-
a good,
Absolutely
based upon
not.
this, is alcohol a good thing? Now,
No.
if we just need sugar,
Then yes, the
okay,
sugar's fine.
but there is some other issues with the alcohol itself. All right, so what is the question here? We know that the parietal cell is what we treat in general to stop what?
Acid production.
Acid. Okay? The goblet cell,
Absorption.
okay, we gobble the food up, right? Okay, now remember, we break it into what? Parts,
Particles.
parts. We're always categorizing in our body. So the stomach is what?
Churning.
Churning. What is this?
Lower esophageal sphincter.
Where does the acid reflux happen?
Above it.
Above it?
In the
What is
esophagus.
this here?
Upper esophageal
Epiglottis?
sphincter. Epiglottis.
Trach. Okay. What is this sphincter?
Pyloric sphincter.
Okay. What is this goofy looking thing called?
That's your
So
gallbladder.
what if I don't have a gallbladder?
You
It's
need to
gone.
take a lower fat diet.
Right, because lipase can't handle, I still produce bile in the liver cells, but it's only a direct tube, I don't have that little bag to store it in. What if I'm constantly eating high-fat meals? Am I going to produce extra bile?
No.
High fat, yeah.
Yeah, I have a
Oh,
gallbladder.
oh, you have a gallbladder? Yes.
So how do
Yes.
I get gallstones?
By too much produce. It's
Right? And the more I
You're
produce,
producing too much.
the more it can have a chance to what? Dysfunction and accumulate, right? Because there's a little sphincter here, there's a little sphincter here, there's all these little sphincters to what? I just can't have bile just oozing around, there's always a sphincter. All right? So, what do we know about the pancreas? It produces digestive enzymes. It has what? Signals, especially for bicarbonate, because how do we neutralize that stomach acid? I mean, we can't just let it
Bicarbonate.
roll on into the small intestine. Now, if we have a dumping syndrome, what is the analysis of the stool sample going to show? A lot of
high acid,
high
hydrochloric
acid because it's gone through too quickly, right? We haven't neutralized it. So, why do we need to control insulin and glucagon? Our sugar. So, if I'm eating lots of sugar, okay, am I putting work on my pancreas?
Yes.
Okay.
Your K cells are starting to produce a lot of cells, or
So-
a lot of.
Why do we have the K cells? That's exactly what I was. We need to absorb water and electrolytes. Who tells us? Oh, I need water. I am thirsty. I'm thirsty right now. I need to take a drink. What is happening? Brain,
Sending a
urge
signal
here, but what do you think we're getting a report from where?
from the VIP.
The very important to say, hey, look, could you please send some water my way? I am getting dehydrated. Okay? Why do you crave salt? People are like, I don't know how. Oh, wait a minute. Yeah, you do know how. You can tell patients how you crave salt. Why? Because the electrolyte's saying, I don't have enough. Okay? So, I mean, pretty much you can answer most of the digestive questions. What do you produce in the mouth? Digestive enzymes. Same type of enzymes here. Are they there to absorb food? No.
No.
They're just helping it
Break
on
down.
its way down. So the more we chew, the less the stomach has to
Has to work.
The less food we eat, now I'm not saying not to eat enough, but the less we eat in a large 3,000 calorie meal, the stomach has a chance to what?
Break it down.
That's why that frequency meal thing works, because the body can handle it in what? Parts. Okay? Smaller portions. All right? But there is an argument for larger portions for particular patients, but not most. All right, so what is the big problem here? I mean, this is how the digestion works. Obviously, you can see how stomach ulcers, small intestine ulcers. You could see even how colitis, okay, and what? Irritable bowel syndromes are happening based upon what? The information given to it. Okay? Yes?